Hey guys, Dr. Fred here. We're going to walk you through a foreign body hunt. Let's check it out. So we got urinary bladder. Adjacent to it, we have small intestinal luminal dilation. We also have some scant diffusion right here. And then right here, I see the colon, descending colon immediately underneath the bladder. I'm going to keep progressing. I still see this distended small intestine with just loose digestia. Looking at the prostate, colon, following the prostate again. Still see that small intestinal dilation. Here we have our colon, descending colon. No foreign body here detected. Iliac trifurcation. Looking at color. Kidneys look good. We're in transverse view of the left kidney. We have some gas within the small intestine here. Looking at our adrenal gland, we have our left renal artery, frontoco-abdominal. Here's our left adrenal gland. Okay, spleen. We have empty small intestine here. Okay, so that's kind of a positive predictive indicator that maybe we do have some sort of obstructive pattern. Spleen looks okay, maybe slightly enlarged. Okay, seeing stomach. Getting into splenic hilus. Looks good. No more blood flow. And again, I'm still seeing that empty small intestine here with some with gas, some empty. In the area of the left pancreas, however, I'm not seeing it due to overlapping small intestine. Now we have the stomach. We have gas plus mild distension of loose anechoic fluid and mixed ingestia. Following that down again, it is mild to moderately distended. Moderately, after we get into this more, we get into the pylorus. Okay, we want to see if there's anything in the pylorus here. Following that down, I'm not seeing any overt shadowing material that would indicate an obstruction there. So right here is our pyloric area where it goes in the duodenum. There's duodenum, not seeing any foreign material there. It's following it down even further. We got the right limb of our pancreas. Still no evidence of an obstruction here. Spleen is kind of getting in our way. So there's stomach, following it down. Checking out the liver. Again, here's duodenum. So no upper gastrointestinal obstructive pattern or reason for the obstruction there. Looking at our right part of the liver, we do have some mild suspended echogenic gallbladder debris. Okay, here's another great shot. I'm able to see this duodenum here. Kind of have a hypermodal sort of subjective appearance here within the duodenum, like it's trying to push things further. Looks like the liver is quite intercostal, but no evidence of lesions, nodules. Echogenicity looks good when compared to the spleen. Right kidney. Again, I'm looking for small intestinal distension of gas or empty coupled with luminal distension of fluid, echogenic digestia, or even shadowing material. So now we're looking at the right adrenal that's kind of hiding under here. Again, here's our duodenum that's mildly distended, hypermodal. It's kind of sitting here stagnant. Okay, it's trying to go somewhere. We've got some mesenteric lymph nodes here. We're scanning the abdomen. I still haven't seen any shadowing material. We got this section that kind of has this gas in it. Right here, I'm following this. You can see underneath there is loose digestia. Do have this focal area here where we have mild submucosal prominence. There's gas within the lumen. It is mildly thickened. And we also have some regional inflammation around it. So this is QMIA here, that there's an area here of small intestine that is concerning. I'm going based on regional inflammation around it. The submucosal layer looks mildly prominent. Yeah, so this is this area of small intestine here. It's not overtly shadowing. However, there is suspicious luminal material that's not overtly shadowing, but it's enough to catch your eye. It also, like I said, I know this is small intestine because when I run it in here, I can tell the layers is a small intestine. Here's it's feeding into normal. And then when you come back, it goes to this shadowing material. Now that's a little bit more obvious here. Yep, and then here we have adjacent luminal dilation. Yes, this is the area right here. Things that catch your eye here is, this inflammation around it, and you have this indiscrete wall layering that you're able to appreciate. Yep, coupled right near adjacent, we have dilation present. Yeah, drives it into a dilated small intestine. So in this case, I think because we have that mildly shadowing material right next to that indiscrete wall layering with transmural inflammation, this to me, with the presence of that duodenal dilation, is an indication that we need to go in and explore this patient because there's a strong suspicion for foreign body in the jejunum small intestine.